Hi, everyone. My name is Elizabeth Shepard, and I'm a fourth-year medical student at the University of Washington. I'm applying into plastic surgery, and I'm giving this talk. So this video is really meant to serve as a very brief overview of the specialty with an emphasis on how to be a competitive applicant. So what is plastic surgery? There are definitely some misconceptions about the specialty. When someone says plastic surgery, most non-medical people immediately think of cosmetic surgery. But in reality, cosmetic surgery is only a very small part of what plastic surgeons do. I found that referring to it as reconstructive surgery or even as connective tissue surgery can often be more descriptive. And the focus of the specialty is on restoring form and function to people who have diseases or deformities, whether or not those are congenital or acquired. It includes craniofacial surgery and other pediatric plastic surgeries, facial trauma reconstruction, hand surgery reconstruction after cancer, urologic reconstruction, breast surgery, burn surgery, and countless other types of reconstruction. I chose plastic surgery for a number of reasons. The focus really resonated with me. I think it's very noble to save lives, but restoring a form and function for patients in a way that allows them to live in the world more meaningfully is something that I wanted to do. I think there's really, it provides very holistic care based on the fact that you're focusing on the patient's quality of life. It's an interdisciplinary heavy specialty, so you're working with orthopedic surgeons, cancer surgeons, urologists, and other specialists frequently. You're a true general surgeon in the sense that you're operating all over the body from head to toe. That's all fair game. And because of that, you really see an incredible amount of operative variability, which is exciting. And you're treating all types of disease pathologies, whether those are congenital or trauma or chronic. Those are all things that plastic surgeons address. And then lastly, you can develop longitudinal relationships with patients, in particular in pediatric plastic surgery. You're seeing those patients for years, and that is very rewarding. There are two ways to get to plastic surgery. You can either do a 6-year integrated residency program, which is definitely more common now, or you can do a general surgery residency and then a 3-year plastic surgery fellowship. For the 6-year integrated residency program, the first 2 to 3 years are very general surgery heavy, but then the last 3, 4 through 6 years are plastic surgery specific. The average salary that a plastic surgeon makes is $400,000 per year. Private practice surgeons tend to make more than surgeons in academics. And then you're in the operating room all but about 2 days per week when you're in clinic. Addressing the rotations that you'll need to get into the specialty. So the required rotations, you have to have your core general surgery elective, and you'll have to do a plastic surgery sub-internship at your home institution. And then it's an unofficial requirement, but you do need to do away rotations at other institutions. So those are 1 month long. You'll apply into those programs, and I'll talk about that a little bit on the next slide. People typically do between 2 and 3 aways. And then some other helpful or related electives. I think having a SICU or trauma ICU rotation can be helpful in teaching you how to manage very sick patients. Burn surgery is important because plastic surgeons deal a lot with burns. Ear, nose, and throat, an elective in that can be helpful because you can see some of the mandibular reconstruction and facial plastic surgery as well, which is pertinent to plastic surgery. And then general orthopedics, or specifically any type of hand or upper extremity, can be really applicable to plastic surgery and help prepare you for residency. For plastic surgery specific rotations, the best time to do your home rotation would be in the late spring or early summer of the beginning of your 4th year. And that's a good time to do it because it's just less heavily populated by visiting students. Away rotation season is from July to October, so that's when you'll be doing your away rotations. I mentioned that it's recommended to do between 2 and 3. I personally did 2 away rotations. Each rotation is 1 month long, and then you'll apply for those through a portal. It's called the VSAS portal. Your school will give you some information on that in the fall of your 3rd year. You should begin to look at programs in December of your 3rd year, even though the applications aren't formally due until anywhere from January to March as well. And it's important to remember that not all schools use the VSAS application portal. You'll have to apply independently through information on their website. For letters of recommendation, plastic surgery requires 4 letters of recommendation. It is strongly recommended that all 4 of them be from plastic surgeons. It is okay to have one be from a general surgeon or a research mentor, but it's really much preferred that they be from plastic surgeons. It's also important that you know your letter writers very well so that they can write you a strong letter of recommendation. Also, a pro tip when you're asking for a letter of recommendation, asking your letter writer if they can write a strong letter of recommendation is extremely important, because if they're going to write you a mediocre letter, that doesn't really reflect well on you, and it's important to know up front if they feel confident in their ability to write about you well. You want to request the letters in about the summertime before you submit your application, and give your letter writer 1 to 2 months to write the letter if possible. It's good to get at least 1 to 2 letters from your away rotations, which can be challenging but is important. And then the letters are going to be uploaded and submitted to the ERAS application portal, and there are instructions when you get to that point on how to do it. Plastic surgery is a competitive specialty, but I'll talk a little bit on how to be competitive and what is expected. So the average step 1 score is 250. It is an average, so they take anywhere from 230 to 270. Scores less than 230, it's recommended that you would take step 2 prior to submitting your applications. At the University of Washington, you're required to take step 2 prior to applications anyway, but the goal would be increasing your step 2 score to bolster your application. And then failing step 1 does make it incredibly hard to match into plastic surgery, so at that point, it might be best to consider other specialties. For grades, it's very, very important to have an honors in your general surgery rotation, and then in your plastic surgery home institution and away rotations. A mix of honors and high passes and other rotations is fine. And then research is definitely a must-have for plastic surgery. Plastic surgery specific research is preferred, but there are other types of research that can be applicable, like cancer research or breast cancer research, other types of oncologic research. It is important to have a backup plan just based on the fact that it is a very competitive specialty. So I think in your 3rd year, really critically assessing your competitiveness, how much research you have, what your grades have been, what your step score was, that's important. It's definitely okay to ask a mentor to help you. That's something that I did. I asked a couple different surgeons if they thought that I was competitive. People will talk about dual applying into general surgery and plastic surgery, especially because you can get to plastic surgery through general surgery with a plastic surgery fellowship. And it's really kind of a controversial topic. It depends on who you ask. So I would just ask your own independent mentor about that. I personally did not dual apply. And then it is okay and even common to take a 5th year, like expand medical school, take a 5th year, use that for research, and that will increase your competitiveness as well. And I'll talk a little bit about interview season. That's where I'm at right now in the process of interviewing for residency. So for plastic surgery, it is important to apply widely. A lot of my colleagues applying into different specialties applied to 20 or less schools. I applied to 60 schools. And then the goal would be to interview at roughly 15 programs. Based on years past, 93% of applicants who interviewed at 13 programs did match into the specialty. And plastic surgery interview season is later than other specialties. It's from November to January. And so I would recommend leaving your schedule as open as possible in December and January. I took the entire month of January off. And as of this year, there's a new recommendation, which is that interviews are sent in bulk. They were sent out by all the schools on November 1st, and then there was the second wave of interviews that came in by November 15th. And that's different from the old system, which was that interviews rolled out anywhere from the middle of October through January. This system sends them in discrete waves with the goal of making it easier for applicants so that you can schedule and plan your travel a little bit easier. And the last thing I'll touch on is fellowship programs and options that you can apply to after residency. People typically apply for a fellowship in their 5th year. So you can do microsurgical fellowship where you're connecting blood vessels and nerves together underneath a microscope or using your loops. There's hand surgery, which is, depending on your institution, anywhere from the elbow down or from the wrist down. Craniofacial surgery and pediatric plastic surgery, which includes craniofacial surgery. You can do an aesthetic fellowship as well. And then there are just a handful of new transgender fellowships in the country, probably going to be increasing in the next coming years. Each of these fellowships is just one additional year after your residency is complete. All right, and that is the conclusion of the presentation. So thank you so much for listening, and I hope that was helpful.